Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Thursday, February 4th. We are joined today by the Yukon's Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Once again, our sign language interpreter, Mary Thiessen, and André Boursier from French Language Services Directorate are with us again. Following our speakers, we will go to the phone lines for questions from reporters and from reporters in the room. We will call you by name and you will each have 2 questions. Before we begin with our speakers, I'd like to verify that everyone can hear us. If any of the reporters are having a problem, please email eco@yukon.ca. Premier Silver?
Thank you very much, Pat. And thank you all for joining us today on the traditional territory of the Kwanlin Dun and the Ta'an Quachin as well, Council. It's great to be here with Mary and with Dr. Hanley to provide another update. For the 3rd consecutive week, we have no active cases of COVID-19 in the Yukon. This speaks volumes about the good work Yukoners are doing to keep our territory healthy and safe. So thank you very much for your diligence. We are happy to see our case count stabilize, but we need to be careful now not to give us false sense of security. We know from past experiences here in the territory and watching developments in other parts of the country and around the world how quickly the virus can spread if we do let our guard down. A very important part of our strategy to prevent the spread of COVID-19 in the territory is testing and tracing. Contact tracing. Our ability to react quickly and to keep the virus contained depends on detecting cases early and ensuring close contacts are identified, tested, and self-isolating as required. It is still very important to get tested if you are experiencing symptoms of COVID-19. We have a self-assessment tool available on yukon.ca, and you can also call 811 if you are feeling symptoms and if you need guidance. Please do not hesitate to get tested. It's very important to keeping our community safe. Testing is especially important as we learn more about the new variants of COVID-19. And they've been found around the world and are showing up here in other parts of Canada as well. Dr. Hanley will have more to say about the new variants in a moment, but they are a sobering reminder that we are still in the grips of a global pandemic. This is still a dynamic and rapidly changing situation, and we must, as Yukoners, remain vigilant. This means continuing to practice the Safe 6+1. In the past week, we laid 2 additional charges under the Civil Emergency Measures Act, one for failure to self-isolate and one for a failure to wear a mask. Our CIMA enforcement officers continue to do a fantastic job of informing people of the rules and enforcing violations, so I want to thank the whole CIMA team for their ongoing efforts. The best thing you can do, Yukoners, to keep yourself and the community safe is practicing the Safe 6, washing your hands often, maintaining the physical distance, staying at home if you're sick, traveling responsibly and respectfully, self-isolating as required, and following gathering guidelines that are in place, including limiting indoor gatherings to 10 people. Plus, the +1, remember to mask up in public. I have to say I really appreciate seeing so many people wearing masks out and about. It is one simple but effective thing that you can do to help protect your friends and your fellow Yukoners. So, again, thank you very, very much. Let's keep that going. Earlier this week, Minister Frost and I provided an update on our vaccine rollout. Last Friday, Moderna announced a reduction in their next vaccine shipment to Canada, which is scheduled to arrive in the next few days. As a result, the federal government has notified us that our next shipment of vaccines will be reduced from 7,200 doses to 4,500 doses. It is also anticipated that our 4th shipment, scheduled for late February, will also be reduced from 7,200 to 4,500. Though we are waiting for confirmation from the federal government on that one. If this is confirmed, that would mean that we will receive 5,400 doses less than we anticipated receiving in the month of February. Our territory is one of many jurisdictions in Canada and around the world for that matter who will see reduced shipments of the COVID-19 vaccine in the coming weeks. Like these other jurisdictions, we now have to adjust our rollout schedule to ensure that those who receive their first shot will be able to receive their second shot on schedule. Mobile clinics scheduled for rural communities continue this week, and the clinic here in Whitehorse continues to immunize residents age 60 and up. These smaller shipments will delay the public opening of the vaccine clinic in Whitehorse. We had planned to open the clinic to everyone over the age of 18 next week, but at this time, we simply do not have enough vaccines to do so. This is not what anybody wants to hear, and I know that it's not the news that I want to deliver either, but we do not control the supply of vaccines. We can only control what we do with the vaccine once we receive it. Fortunately, we have enough vaccines to give second doses to everyone who received their first dose, including folks that are receiving them now in Ross River, Haines Junction, Mayo, and Stewart Crossing. Within the next week, we will be opening up the booking website for people to make appointments for their second dose, so stay tuned for that. This week and next week, residents in long-term care and high-risk health care workers are getting their second doses, and we will continue to go back into the communities to deliver the second doses. Jurisdictions are doing things differently as a result of this delay. Some are giving second doses as a half dose. Others are stretching the time between the first and second doses. Quebec is only giving first shots out. We are following our original approach, which is to make sure that we have enough vaccines available so that everybody who gets their first shot will get their second shot. Those doses are here, they're in the fridge, and they're waiting for you. We remain committed to a safe and effective rollout of the vaccine delivered to all Yukon citizens. We really want to get people in rural Yukon immunized, and hopefully at least 75% of all eligible Yukoners in the communities. The uptake in rural Yukon has been very good, but there is capacity for more, so please come out and get your shot. Mobile teams are in Haines Junction, Ross River today, and will be in Mayo and Stewart Crossing tomorrow and Saturday. In addition to booking appointments, the teams are seeing a lot of walk-ins in the communities, and that's a good thing. It means that people are talking to other people and hearing that the vaccine is a good thing. I want to thank everybody who has spoken up about taking their shot and their importance of doing so. These are important conversations to be having, and I'm very hopeful that they will continue, and very, very grateful to see people posting on social media their reasons for getting their shots. I want to send a big shout out to our mobile immunization teams, Balto and Togo, as well as to teams at the Whitehorse Clinic for all of your efforts to ensure Yukoners are able to get their shots in a safe and efficient manner. From fireworks in Old Crow to lit paths in Haines Junction to amazing stories of cooperation in all the communities, including mine in Dawson. It's just absolutely amazing to see Yukoners come out and support Yukoners in this, our time of need. So thank you, everybody, for being so supportive. As of this morning, we have vaccinated more than 9,930 people. This is nearly a third of our adult population, and it means that we are well on track for our goal of 75% to reach population immunity. Our vaccination rollout schedule was designed to be flexible based upon vaccine availability. The supply of vaccines remains the responsibility of the federal government, and we continue to work closely with them to ensure that the North gets priority access to the vaccine as recommended by the National Advisory Committee. The opening of a general clinic in Whitehorse will depend upon availability of vaccines. We will be getting additional information from the federal government, and we will keep Yukoners updated. We will continue to receive assurances. We continue to receive assurances that we will receive full allotment of doses by the end of March. This means that we are experiencing a temporary setback, but we will remain on track to provide the vaccine to eligible adults in the coming months. And we remain committed that as we receive vaccines, we put one in your arm and we keep one in the fridge for you. To date, this information that we have received commits to the delivery of enough vaccines for our adult population in the first quarter of 2021. The vaccine is an important step in our fight against COVID-19, and make no mistake, it will and does save lives. I encourage everyone to remain patient as the rollout continues. The first Yukoners received their shots just a month ago, and already nearly 10,000 Yukoners are immunized, which makes a very hopeful start to 2021. The move towards population immunity allows us to consider what the next few months are going to look like. Once again, we have vaccinated a significant portion of our population, and we hope to be in a position to start lifting public health measures in a way that is supported by the epidemiological data in Yukon and the rest of Canada as well, in a way that reduces the risk of transmission and resurgence. We will continue to make decisions that prioritize the health and safety of Yukoners based upon the recommendations of Dr. Hanley and his team. I invite Dr. Hanley to share some of his thoughts on our current situation and the factors involved in charting our path forward. We are in a very fortunate position with no active cases. Let's continue to do what we need to do to keep our fellow Yukoners healthy and to keep the virus at bay. A big thanks to everyone in the Yukon for doing their part. We've come a long way over the last 11 months, and we continue to be patient and vigilant as the vaccines roll out and continue. And we will be continuing to practicing the safe 6+1, and we're going to continue as Yukoners to do what we do, which is to look after and take care of each other. And I want to thank you for all that work over the last 11 months. Masi Cho, Gunas Chish, Choni Thun. Off to you, Dr. Hanley.
Thank you, Premier Silver. Dr. Hanley.
Thank you, Pat. Thank you, Premier. Good morning, bonjour, bon matin. I'll just correct one thing that the Premier said, and I think we're keeping those second doses in the freezer, not in the fridge. At least I hope so. As we look to our neighboring provinces, the cases are trending downwards, and that's encouraging. Although the emerging presence of COVID variants, as the Premier mentioned, is a concern that I think we all share. And I am happy to endorse that we remain with 0 active cases in Yukon. But again, to reflect on the Premier's comments, we do have to be ever mindful of that risk of COVID-19 reappearing in Yukon, particularly with significant activity in northern BC communities at the moment. Seeing COVID activity in many parts of rural or northern regions of Canada reminds us how quickly COVID-19 can appear and how difficult it can be to get back under control. How hard it's been to keep up our vigilance through such a long period of time, now 11 months. Remember last fall when, after a quiet and quite safe summer, it seemed that people began gathering with larger groups of friends again, and maybe didn't take physical distancing as seriously, and maybe weren't overly concerned about a hug with a friend that they hadn't seen in a while. And while these actions can seem harmless when there's no disease circulating at the time of a pandemic, they can lead quickly to unfortunate consequences when COVID is hidden but present. When only a couple of months ago we announced the imminent arrival of vaccines, we all felt that rush of optimism and hope. And there was definitely excitement within the air, and I'm sure many of us felt a sense of relief. However, since that day, we have seen a few more twists and turns in this pandemic that we need to address. And although the hope remains, there's no doubt that the rise of the variants has tempered the enthusiasm. But even if the road is a little more rocky, vaccines are still our way out of this pandemic. As we negotiate these current roadblocks, we need to remember that vaccines are paving the way. Variants and vaccines, that's the dynamic ahead of us for the next few months at least. As the Premier said, we're closing in on 10,000 people vaccinated. Last week, Team Balto and Togo completed their first trips to Pelly Crossing, Teslin, Carcross, and Tagish, administering first doses to the residents of these communities. And this week, the teams are in Burwash Landing, Destruction Bay, Carmax, Faro, Haines Junction, Mayo, and Stewart Crossing. For those of you who may not have been present in the communities for the first clinic, Team Balto and Togo will be back returning to communities to provide second shots. If you missed the first time or just didn't feel ready, you are able to get a first shot during this visit, and they will be back a third time to ensure that everyone who wishes to get immunized has the opportunity to do so. Of course, in Whitehorse, we have had to alter the schedule to align with the recent shipment cutbacks in Moderna. For the short term, this has meant delaying the opening of the clinic to the public in Whitehorse. And I understand this is disappointing news. I can tell you that I was surprised and disappointed myself at the sudden news we had last week. Many people I know were getting prepared to book in the upcoming days for their appointment, and I was one of those. The good news is that 10,000 people or more will receive their second doses, and that will give a firm foundation for the protective layer that we need of vaccine in our community. The people about to receive their second shots are our most vulnerable: seniors and residents in long-term care, and those who work on the front lines supporting and caring for others. Residents in rural Yukon will also receive their second shot in the coming weeks. Remember that as Northern Territories with remote and rural populations, we have been privileged to receive a high per capita allocation of vaccine this early on. That is why the 3 territories are leading the country in vaccines administered per population. We have a setback, but this does not change our medium to long-term plans, nor the order of delivery of vaccines, nor the commitment to protect our most vulnerable citizens and our rural communities. So although this is definitely a bump in the road, not the first, and I'm sure not the last, we will get there. We'll not be finished by the end of March, but as long as our supplies pick up again in March, after the reduced supplies this month, then we will be able to continue to immunize a majority of our adult population before the days are warm and before our time becomes filled with summer plans. As I mentioned last week, we have allocated our current doses to ensure everyone who has received a first dose will receive their second in an appropriate time frame. And we currently have enough doses to finish our visits to all communities and, again, ensure that every person up until the end of this week can receive a second dose. I want to acknowledge the frustration that many of you are feeling, and I sympathize. For some of you, I'm sure it has felt that this past year, which has been torn away from us in so many ways, is now carrying over into a new year with tough surprises. There are so many events and plans over the last year that have had to be put on hold. There are those many occasions to celebrate, moments usually shared in person, that are now relegated to virtual get-togethers. Painful decisions have been had to be made with families separated due to COVID measures. Now more than ever, we have to be patient. More vaccines will come, but we have to keep flexible with our plans, as always, when circumstances change. As much as I wish it were not the case, we need to prepare ourselves to continue to face challenges throughout 2021 as the pandemic continues. Variants, of course, have been the focus of recent news articles as they've appeared in BC, Alberta, Ontario, and most recently Saskatchewan. Yes, there is reason to be concerned, and this is currently a major focus of ours. Although there's much to learn, I think there are a few useful facts that we know already. Firstly, what is a variant? Simply put, the virus is always mutating or randomly changing its structure, just an amino acid here and there. Remember that this is a virus that is still learning to adapt to humans. Some of these random mutations will result in a better fit to human receptors, a better match to invade the body and make more virus, which is what they are programmed to do. Sometimes when these mutations allow for forms of COVID-19 better adapted to humans, new versions of COVID-19 emerge and may even start to dominate over the usual strain. Currently, there are multiple variants circulating throughout the world, and we are likely to see more emerge. The three best known at present are the B.1.1.7 variant, affectionately known as the UK variant, the B.1351 South African strain, and the P1, the so-called Brazil variant. Currently in Canada, both the UK, the B.1.1.7, and the B.1351, the South African variants, have been identified. So there is still much to learn about these COVID offshoots, but it does seem that variants, especially the B.1.1.7, can spread more easily and quickly than other variants, than the COVID-19 regular virus. And this could lead to a significant jump in COVID-19 cases where COVID is circulating. It's a cause for concern, as we've seen in the Barrie long-term care home outbreak. And if variants are allowed to circulate, a rapid rise in cases could lead to a strain on healthcare capacity, to more hospitalizations, potentially more deaths. So what are we doing in Yukon to handle the risk of variants? I'd like to talk about detection, prevention, and management briefly. None of these measures are radically new. It's more a matter of doing what we already know how to do, but doing it better. On the detection front, we're working closely on a national level with our colleagues around the country. PCR testing does pick up the COVID-19 virus, whether variant or normal strains. Because gene sequencing takes a lot longer, we won't know a COVID variant right away, although we can be suspicious under certain circumstances, either by the origin of the case, such as a case related to international travel, or connected to an area where the variant is known to be circulating. Or we may be suspicious because of the apparent behavior of the virus, such as very rapid spread in an outbreak. We continue to work with our colleagues in BC as they expand their ability to detect variant cases. Meanwhile, our case and contact management will continue to be very cautious for any case that we do see. Confirming a variant will always take time. We may not know for days or even weeks. So our approach with cases will be to assume a variant until we know more. That means close contact tracing. It means cases self-isolate, either alone and away from family members, or if already isolating with others in the household, that means a longer period of self-isolation to ensure there is no spread within a household. This is how we have already been managing cases and will continue to do so. So variant COVID strains are definitely a concern, but in our situation, where we stay in containment mode, rapid identification of cases, aggressive contact tracing, intensive follow-up of cases and contacts, there is no reason that we cannot maintain control of these variants, just as we have with regular COVID. We all have our part in this, and although we may be feeling discouraged, perhaps overwhelmed, by staying informed and prepared, we can and will stay in control. As the Premier says, observing the Safe Six is as important now as it was when we first advised it. Tired as we are, and grateful as we are for the vaccine supplies that we have, it is crucial for us to continue with all the Safe Six features, including the seventh step, masking in public indoor places. On a more positive note, Moderna released news last Monday that its variant does lead to antibody production, which neutralize COVID-19 variants found in the UK and South Africa. Moderna is also continuing to work towards a booster shot, as are other vaccine companies, that can be administered for future variants. This is really good news, and we will continue to monitor this situation as well closely. For the time being, until we know more, again, we must note that our best defense is practicing the Safe 6+1 and to get immunized when vaccine is available for us. I continue to see many questions, whether direct or on social media, on the various media, and even perhaps from friends and family about when are we going to be able to lift restrictions and public health measures. The question seems to be, if we still have to stay locked down even after the vaccine, why bother? Well, there's lots that we should bother about. We will continue to find out more information as the days go on, and we will plan accordingly on how the months to come will look. The question of when public health measures will be lifted is definitely on our lips and on our tables as much as it is on yours. And now, with the newly discovered variants, it's difficult to say with any certainty when measures will be alleviated. As we emerge from the pandemic, we will and are planning what the next few months will look like. It's our goal from myself and my team to provide recommendations for the government as a path to allow Yukon to emerge from public health measures once we have vaccinated a significant portion of our population, and in a way that is supported by the epidemiological data in Yukon, and of course in the rest of Canada and the rest of the world, and in a way that reduces the risk of transmission and resurgence. As you can see, there are many elements that play, and again, it's that dynamic of vaccine and variants and COVID activity, locally, regionally, internationally, that will inform how we emerge from public health measures. Eventually we will. We have to. But the timing is really difficult to predict at this moment. I know that the Path Forward document says that vaccine would allow us to enter into phase 4. And I think perhaps we are in phase 3.5 now. We have the vaccine. We, of course, need to continue vaccinating more people. And we did not, at the time of the plan, factor in the variants that are potentially more virulent and certainly more transmissible than the original virus. So I know many have not left the territory in more than a year. I'm one of them, and for some it's been longer. And it's upsetting to know that Yukoners may not have held their loved ones in their arms and not been able to see friends on momentous occasions or to be with family during difficult times. As we progress with the immunization of Yukoners, I've mentioned within recent weeks that changes to public health measures may not be as soon as originally we had hoped and as we were thinking at the time of the writing of the Path Forward document. So Yukon, even with an accelerated vaccine program, will only truly feel like it has returned to normal when there's a certain level of normality in the rest of the country as well. And given the risks in the rest of the country and the world, we clearly can't expect immediate or even short-term changes. So what do we need? Well, we need that confidence that if we are, even when vaccinated, that we cannot transmit or pass COVID-19 onto others. So the role of vaccine in the prevention of asymptomatic infection and transmission still needs to be clarified. And of course, regardless of that question, we still need to reach a certain number and a proportion of our population to be vaccinated when we can feel confident enough that the risk is low to our population. Healthcare workers and staff behind the scenes, all of us, all of you have worked so hard, and it's really too soon to give up now. We're so close to seeing some things that we have been missing this past year return to our lives, even if we don't know the exact timeline for that to occur. So I think I see it, through this winter and into the spring as this real push, potentially a final push together as Yukoners. We are close to seeing our efforts pay off. It will be longer. It will be at least a few months longer. But I know we can do it, and I know we will do it together. So that's all for my update, and thank you. And remember to take care of each other as Yukoners, we are always in this together. Merci, Cho. Merci. Thank you.
Thank you. We'll move now to the reporters, and we'll start with Haley from Yukon News.
Thank you. I guess my first question, Premier Silver, you kind of referenced it there that different jurisdictions are taking different strategies. Dr. Hanley or Premier Silver, could you just run through why we decided to put the emphasis on second doses instead of a different tactic like one doses for all, that kind of thing?
It's a great question, Haley. Dr. Hanley, I'll pass it off to you mostly, but it's because of the recommendations of Dr. Hanley and also the recommendations of Moderna and the recommendations of Health Canada. I think that's as succinct an answer as possible. Dr. Hanley?
Yeah, it is a really good question, and you know what we really want is protection of our vulnerable populations as kind of the first tranche or the first priority, and that protection can only be assured on the basis of a second dose. So that promise of a second dose is fundamental to the success of our vaccine program. Perhaps in other situations, I think the rhetoric has to be a little different. For instance, if there is high COVID activity, then it's a matter of where are you going to put your risks, and we've mentioned Quebec's approach, for example. We've seen this approach in some of the European countries, is sort of putting all your eggs in that first dose, and then risk managing the second dose. There's still every intention in whatever jurisdiction I'm aware of to give that second dose. It's just a matter of how long do you stretch that time. How far can you go? And the current national recommendations from NACI, endorsed by the World Health Organization, many other bodies, is to allow up to a 6-week window, which is not what the product monograph of Moderna says. That advises 28 days. So we realize there's a discrepancy, but again, even that is a kind of a risk management where we're very confident that the second dose will that at that interval will still provide at least as good, if not even better, an immune response than the 28 dose. When we get past 42 days, we're into less firm territory in terms of that assurance, and those are there will be accruing evidence to support that approach, or to perhaps speak against that approach as the real-world effectiveness data starts to come in. But jurisdictions like Quebec, which has such a long and excellent history of vaccine innovation and excellent advisory support and expertise, they are in a very good position to be able to play with the dosing, in a way, play with the intervals, and to be able to measure and assess what they're doing. So we're all looking with interest in Quebec and some of the European countries that are doing this extended second dose. But for the moment, by giving that second dose, we're assuring immunity, and we're giving that immunity opportunity first to the priority populations that we've talked about.
Thank you. Second question again for Dr. Hanley. I know you sort of addressed it there. We're seeing a downward trend right now for cases in BC, but also the variants. I'm just wondering right now if reconciling the divorce is at any point an option, and being able to travel back to BC, what the timeline might be on that.
It's a great question. Yeah, and I'm sure the Premier has his thoughts. Again, this is I play the advisory role in this, and the Premier and Cabinet make the decisions. As I've said many times, how successful our BC bubble was. I think from looking at it from a number of ways, I think we did really, really well. And took advantage of that summer period, mostly summer, when cases in BC were so low, and we were able to open up and enjoy those opportunities. So clearly, it is of interest to us and to many, but I think we're just we're not ready. I don't think we can sort of bank on the present epidemiology in BC to say that it's getting to that comfortable range where we could consider that. Again, I think there's too much at play here, and the northern BC activity is significant. They have had high COVID activity in northern BC right up to areas that are close to our borders. So that's clearly something that we are talking closely with our colleagues in Northern Health Authority, but also watching with our communities in the border areas and trying to be more vigilant. So that's one thing that's playing into it. The other is the variants. The variants are not done, and I do think that it's quite possible that in Canada we will see the variants start to dominate COVID activity. So that could well differ region to region, but we really need to kind of watch and wait and see what's happening there. And then, of course, there's, as I said, variants and vaccine. That's a dynamic. So how will the vaccination enable us to have that conversation in a new way this year as opposed to last year? So very much a really good question, very much on the table, but we're not there yet, I think, to provide any coherent advice at this point to the government.
Thank you. We'll move now to Luke, CKRW.
Thank you. I was curious about if there was ever a consideration of allowing people that have compromised immune systems that weren't part of the age groups in Whitehorse that have already gotten their first dose of the vaccine. I'm curious if there was ever a consideration of maybe like a case-by-case situation where people with compromised immune systems, whether they've recently received cancer treatment or whether they were diabetic, whether they were going to be considered to also be part of getting the first dose and being the first people that got it.
Yeah, that's a great question. Thank you. And I think case by case is a good way to assess it. So we have been fitting in people on an exceptional basis when circumstances necessitate vaccine. And those are for these kind of special circumstances where, for example, there may be chemotherapy and there's medical travel involved, and we're wanting to really sort of time it up, either timing the vaccine for the best immune response given chemotherapy coming up, plus or minus medical travel. So there are some very compelling individual circumstances where we want to try to offer the vaccine. This is limited because we just don't have enough vaccine to offer it as a category to sort of in general people with underlying or chronic medical conditions. I do want to point out that as always, there are many answers to this question. One is that by capturing the age categories, we are actually starting, even now down to 60 plus, we're capturing the majority of people who have underlying medical conditions. As you know, chronic medical conditions increase with age. It's kind of almost a natural phenomenon that the older you are, the more chance there is for you to have some kind of chronic medical condition, and often a few. So by taking care of those tranches of age, we're also taking care of many people with underlying medical conditions. If you look at the data on how people fare when they are infected with COVID-19, if they're young with chronic medical conditions, they do much, much better than people who are older with chronic medical conditions. These are dramatic differences. Age is by far the more important driver of COVID risk than underlying medical conditions. So as a 20-something with diabetes has at best a marginal difference in outcomes compared to someone who does not have diabetes at the same age. So really our focus is on those who are kind of proven to be the most, at least as far as the best evidence tells us, who are proven to be the most vulnerable or susceptible to to COVID infection, either because of age, so primarily our focus has been on age, settings, long-term care, these congregate or group settings, or vulnerability by virtue of being a frontline healthcare provider.
Thank you. Next question, Luke?
I'm just curious, this is a question for Premier Silver, because we're getting reduced shipments, at least with this initial shipment in February, and like you said, possibly the one at the end of February, are the shipments of vaccines coming in March probably going to be larger than the 7,200 doses that we were getting?
Yeah, good question, Luke. We don't have confirmation as to dates or amounts in March. We do know that the federal government and our conversations with the federal government have continued to state, they've continued to state that within the first quarter, we are still on target to getting our, basically the adult population vaccinated, those vaccines delivered into Yukon in the first quarter. We just don't have the dates on when as of yet. So that commitment is still there from the federal government as of today. And so just more information will come on the Moderna shipments.
Thank you. We'll move to John, CKRW.
Hi, this is a question for Premier Silver. You did just mention how there is no official confirmation in regards to the amounts that will be in the vaccine shipments. I'm wondering if maybe there are some discussions that will be happening with the federal government, either now or in the future, in regards to trying to ensure some sort of an increased shipment?
Yeah, I mean, I guess what we're hearing from Ottawa is they can't give us information that they don't already know. There's conversations internationally as far as distribution goes right now, and what we are experiencing by all accounts is a blip and hopefully not a trend. And we don't seem to think that this is a trend. We just think that this is working out the initial, the physical realities of distribution, basically. We've heard conversations from the European Union. We've heard conversations from the States. We've heard great news from the federal government as far as distribution of Canadian-made vaccines coming up. But what we don't know is, when Moderna lands in Canada yet. And but we do know that, the Prime Minister has spoken directly to the CAO of the organization, of the company, and does not foresee a long-term delay, but more, this is an expedition issue, and but they still seem to be very confident in telling us, Yukoners, and telling the government here that we are still on target for getting all of our vaccines delivered in the first quarter as they promised. I've been saying from the beginning we would love to have seen those front-end loaded. We were putting pressure on, as every other jurisdiction has, to get front-end loaded vaccines here in Yukon, but the commitment is still there that we will get our doses. We would love to know when the March shipments are scheduled, but what we do have here is a system that has been designed to be flexible, and the health professionals here in Yukon have done a Herculean effort to not only get people immunized, the 10,000 that are immunized now, the mobile teams, the clinic here in Whitehorse, but also their ability to plan that flex in the distribution. It's astounding to watch the work done at Health and Social Services, the work done with the mobile teams, the administration of those vaccines, and also just the strategy. So the message to Ottawa is we're ready with our clinic here in Whitehorse. Our mobile teams have proven effective, and we can deal with the rest of our vaccines showing up tomorrow. And so that's the good news, is what we have an amazing team here that is going to ensure full protection, and our goal is to roll out the vaccines as soon as possible, and it's always been our priority for health and social, the health and safety of Yukoners.
Thank you. Do you have another question, John?
I do. I'm interested in learning whether or not the Yukon government has some sort of a plan in place in the event of a second delay or further delays with vaccine shipments. Say Moderna can't sort out the issues in regards to their production. What's the plan?
So again, you know me by now, I don't deal in speculation that much. I'm going to deal with science when it comes to our distribution plan. Every time that for the last 11 months, when something happens, whether it's a positive or a negative situation, we work very quickly and very closely with the medical professionals, with Dr. Hanley and his team. We get information out to Yukoners as soon as we have it, and that's what we'll continue to do. I can't say what's going to happen in the future, but I do know that our responsibility here in Yukon is to distribute and get those vaccines into people's arms, and we're doing it the most safe way we possibly can, and we've proven to be able to do that very quickly as well.
Thank you. We'll move to Tim, Whitehorse Star.
Yes, thank you. My first question is for the Premier. Has your confidence and enthusiasm for the vaccine shipments been shaken at all by this? 2 weeks ago, you said you're absolutely confident that everything would go smoothly, and yet we're in the situation we are right now. And if I recall right, Dr. Hanley took a little more cautious approach. So has your perspective on this changed at all?
Yeah, when I said a couple of weeks ago, based upon the information at that time, and that's what I deal with, is the most current and up-to-date information. At that time, we were receiving a steady supply of doses, and then last Friday, that changed. The supply shortage is a global issue that is affecting all Canadians. It's affecting people all across the world. The federal government controls that supply of vaccine, and we continue to work with them to ensure that the North receives that priority access that Dr. Hanley mentioned from the National Advisory Committee. We're very confident that we will receive enough doses in the coming months for every Yukoner who wants to be immunized. Yes.
Great. Thank you. Tim, next question.
Yes, this one's probably more for Dr. Hanley, and I've asked this before. We're 3 weeks into not having any fresh cases, and I understand the 28-day mark is sort of critical in declaring this, but basically, have we eradicated COVID from the territory for the moment?
Yeah, no. So it's a really good question, and I don't think that we will ever be able to say that we have eradicated COVID-19 from the territory. We also don't know what we can't measure, and that goes back to the Premier's earlier comments today about the need to keep testing. That it is possible that there is activity that we miss. As you know, at many times I've talked about the unknown COVID hidden in our midst, and that's why we have to behave as we need to behave, because time and time again we've shown when we have had cases that they have been unexpected. They've been in people who have had often mild symptoms, that they have been barely noticed or perhaps underestimated, and that has caused a transmission, whether in a household or in a workplace, or in other settings. So that whole kind of until COVID is up and gone completely in the globe, we will not be able to say it's eradicated in Yukon. And I don't think this is a disease from everything that we've seen so far. This is not one of those viruses that's just going to go away. It is going to transition eventually, again, depending on vaccine, depending on variants, depending on some of the capricities that viruses have. It will likely integrate and be probably a seasonal illness or a recurring illness that we will manage, and we will integrate into the way that we manage all kinds of other respiratory diseases. It's not, I think, like SARS, which the SARS-CoV-1, which when it came in 2002, 2003, it actually was never a virus that adapted well to being transmissible. And so that it really had those characteristics that made it not a very good spreader. And I think that was behind why it just kind of went away after a while. And this is a different category. So I don't think this will go away, and I don't think we will ever say that it's eradicated. I think we will get to a point where we can say it's controlled and we're comfortable with it, and we can handle it in a way that allows us to gradually lift all of the restrictions and measures that we have in place.
Thank you. We'll move to Claudiane, Radio-Canada.
Yes, the first question for the Premier. So the delays in shipment, nationally, the announcement was for a reduction of 20% in the number of vaccines shipped to the country. Now, the reduction for the territory is 37%, and I was wondering why the discrepancy if we are still a priority? Why is the reduction not at the same level as the countries?
Yeah, good question, Claudiane. I don't agree with the math either, and the conversations are continuing on that front, and they're not the same throughout the North either, so we're continuing to have those conversations. We have our national conversation coming up today with the Council of Federation and the First Ministers' meetings. Dr. Hanley has been, and his team has been told why the allocations are set the way they are. I don't agree, and I'll continue to push for us to get an expedited and bulk shipment into the Yukon.
Thank you. Next question, Claudiane.
Oui, en français, Dr. Hanley, si possible, me réexpliquer donc en français pourquoi on décide de garder les doses pour la deuxième vaccination, la deuxième dose, plutôt que de vacciner comme ailleurs au pays plus de gens avec les vaccins qu'on a en stock.
So the question is for Dr. Hanley. Can you please explain again in French why we have decided to go for the second dose instead of trying to do the first dose with more people in the territory?
Oui, merci pour la question. C'est une très bonne question, et c'est vraiment ce qu'on fait ici, c'est différent que dans d'autres endroits où on a la menace continuelle d'activité de COVID. Donc, c'est vraiment dans les régions, dans les provinces où on voit beaucoup de COVID à ce moment qu'il fait des décisions qui sont hors de normal. Le normal, le moyen recommandé, c'est pour offrir la deuxième dose. C'est avec la deuxième dose qu'on assure l'immunité. Et avec une dose seulement, on n'a pas la garantie, la duration de l'immunité. Donc, et même pour nous, on est dans un trajet moyen parce que on a prolongé plus long que le 28 jours qui est recommandé par Moderna, par la compagnie. Donc, on est, mais pour prolonger jusqu'aux 35 jours, peut-être un peu plus, mais on a une fenêtre, on peut dire, jusqu'aux 6 semaines ou 42 jours. Et avec ça, on a l'assurance de l'Organisation de santé mondiale, de notre conseil d'administration national de vaccins, qu'on peut aller jusqu'aux 42 jours. Et avec ça, ça permet de maximiser la première dose en anticipation de les fournissements de vaccins dans les semaines qui viennent. Donc, on joue jusqu'au maximum intervalle pour donner le plus possible à la population de première dose, mais avec ça, la garantie de recevoir la deuxième dose pour assurer l'immunité, surtout dans les populations plus vulnérables.
Thank you. We'll move to Beth, Canadian Press. Looks like Beth has left us. We'll move to Chris from CBC.
Hi, yes. First question is for Dr. Hanley. Just on these various variants that are out there, is it possible to give a likelihood that we'll see those variants enter the Yukon, and if so, how likely is it?
Yeah, I mean, that's something that we are looking at and trying to model based on importation risk. So we do have an ongoing kind of calculation based on who's coming in and where they're coming from. It's a little hard to be too sure about this at the moment, though, because the data on variants is always it's an emerging picture. I don't think we have a really good picture on where it is. I suspect that there are more variants out there than we're measuring at the moment because of that lag. And I think we need to see, are we going to see a kind of a rising curve, or are we going to see some stability in terms of the circulation of variants? So I think that it's definitely something that we want to get more precision on, but it's really, we're still in that early kind of emerging picture. I do think that we consider, as I said, that we consider that there is a risk that we need to manage imported cases, and all of our cases have been related to importations, or in one either directly or indirectly, so that we need to manage them as if they're variants, because that's the only safe way to manage the variants, given that the potential for increased transmissibility. So it's really hard to put a number on. I would say that at some time or another we will likely see a variant in the territory, but so much depends on the rise and how they start to dominate or not the overall COVID activity.
Thank you. Next question, Chris.
Yeah, thanks. For Premier Silver, you just mentioned that with these discussions with Canada about the math, essentially, and the doses that we're getting during this shortfall, that you've been told why the allocations are what they are. What is that reason?
I'll let Dr. Hanley break down the percentages and numbers. My message to Ottawa has been and continues to be, we're ready, willing, and able with the vaccines. And, again, from the mobile teams going through the rural communities, we've again proven that. I've said directly to the Prime Minister, the Deputy Prime Minister, the Minister of Intergovernmental Affairs, whoever will listen, that they stand to benefit as well if Yukon gets to that adult population. We can hear you. I don't know if you can hear us. Again, we're really close to being one of the first jurisdictions in North America that would be there at a herd immunity. That is good for Yukoners. That's good for the nation. It's good for the recommendations from the Advisory Council as far as checking off the boxes of prioritizations. So we're doing our part to make sure that we put, the pressure on Ottawa to say we are ready for those vaccines. They're modeling as to why they're doing certain percentages. I have a disagreement with them. I think they're looking at it from the wrong perspective, but they do have a justification in their numbers.
Yeah, I will only say that we shared from myself working with the immunization and the planning team. We definitely shared at various tables our concern with that allocation, and the math is based on a slightly different logic. To be honest, without the kind of the tables in front of me, I would have a hard time recapturing that logic. It was based on I think to do with how the original allocation was deployed compared to population. It came from a completely different angle from what we had anticipated. There is a certain logic to it, especially from Ottawa's point of view. We disagreed with that, but that's where it stands.
Thank you. I'd like to thank everyone for their time today. The next COVID-19 update will take place on Thursday, February 11th at 9:30 a.m.